How is the flexor retinaculum positioned relative to the carpal tunnel? Medial, superficial, lateral, or deep? Superficial. The flexor retinaculum forms the anterior roof of the carpal tunnel, superficial to the tendons and median nerve within. How is the ligamentum teres positioned relative to the free edge of the falciform ligament, contained in, posterior to, superior to, or anterior to? Contained in. The ligamentum teres is contained within the free inferior edge of the falciform ligament as it travels from the umbilicus to the liver. What is the relationship between the inguinal canal and spermatic cord? Superior, anterior, posterior, or transmits? Transmits. The inguinal canal is a passage in the anterior abdominal wall that transmits the spermatic cord in males. How are the intercostal veins positioned relative to the intercostal arteries? Posterior, inferior, superior, or anterior? Superior. Within the costal groove, the neurovascular bundle runs in order: vein, artery, and nerve. What is the position of the esophagus relative to the trachea? Lateral, medial, posterior, or anterior? Posterior. The esophagus lies immediately posterior to the trachea in the neck and superior mediastinum, deviating slightly to the left. How is the median nerve positioned relative to the flexor digitorum superficialis? Superficial, lateral, medial, or deep? Deep. In the forearm, the median nerve typically lies deep to the flexor digitorum superficialis muscle belly. What is the relationship between the hepatic portal vein and common bile duct? Posterior, anterior, lateral, or medial? Posterior. In the hepatoduodenal ligament, the portal vein is posterior to the common bile duct and hepatic artery proper. How are the dorsal root ganglia positioned relative to the intervertebral foramina? Superior, inferior, within, or anterior? Within. The dorsal root ganglia are located within the intervertebral foramina. What is the position of the frontal sinus relative to the orbits? Anterior, superior, inferior, or posterior? Superior. The paired frontal sinuses are located within the frontal bone, directly superior to the orbits and deep to the brow ridges. How is the iliacus muscle positioned relative to the iliac fossa? Within, posterior, anterior, or superficial? Within. The iliacus muscle originates from and fills most of the internal surface of the iliac fossa. What is the relationship between the cystic artery and cystic duct? Inferior, anterior, superior, or posterior? Superior. The cystic artery, usually a branch of the right hepatic artery, crosses superior to the cystic duct to reach the gallbladder. How are the plantar interossi muscles positioned relative to the metatarsals? Medial, deep, superficial, or lateral? Medial. The three plantar interossi muscles are located on the medial sides of the third, fourth, and fifth metatarsals, acting as adductors. What is the position of the mental foramen relative to the premolar teeth? Inferior, anterior, posterior, or superior? Inferior. The mental foramen typically opens below and between the mandibular premolar teeth. How is the brachial plexus positioned relative to the subclavian artery? Superior, posterior, anterior, or inferior? Posterior. At the level of the scalene triangle, the brachial plexus roots and trunks are positioned posterior to the third part of the subclavian artery. What is the relationship between the adrenal gland and kidney? Medial, superior, lateral, or inferior? Superior. Each adrenal gland sits on the supramedial aspect of the corresponding kidney, enclosed within the renal fascia. How are the atlanto-occipital joints positioned relative to the foramen magnum? Posterior, lateral, anterior, or medial? Lateral. The paired atlanto-occipital joints, formed by the occipital condyles and superior articular facets of the atlas, are situated immediately lateral to the foramen magnum. How are the semimembranosus and semitendinosus positioned relative to each other? Superficial, deep, medial, or lateral? Medial. The semimembranosus lies deep and medial to the more superficial and lateral semitendinosus in the medial hamstring group. What is the position of the spleen relative to the left kidney? Anterior, lateral, superior, or medial? Anterior. The spleen lies anterolateral to the left kidney, separated by the splenorenal ligament in the left upper quadrant. How is the optic nerve positioned relative to the optic canal? Below, through, above, or anterior? Through. The optic nerve exits the cranial cavity and enters the orbit by passing through the optic canal. How are the palmar arches positioned relative to the flexor tendons? Superficial, deep, distal, or proximal? Deep. The superficial and deep palmar arterial arches are located deep to the flexor tendons and palmar aponeurosis in the hand. What is the position of the mandibular foramen relative to the lingula? Superior, inferior, posterior, or anterior? Posterior. The mandibular foramen on the medial ramus of the mandible is located posterior to the lingula, a bony spine to which the sphenomandibular ligament attaches. How is the transversus abdominis positioned relative to the internal oblique? Deep, superficial, lateral, or medial? Deep. The transversus abdominis is the deepest of the three flat abdominal wall muscles, lying internal to the internal oblique. What is the relationship between the coronary sinus and left atrium? Superior, anterior, inferior, or posterior? Posterior. The coronary sinus runs in the posterior atrioventricular sulcus. It lies on the posterior surface of the heart, directly posterior to the left atrium, before draining into the right atrium. What is the position of the geniohyoid muscle relative to the mylohyoid? Superficial, superior, deep, or inferior? Superior. The geniohyoid muscle lies superior to the mylohyoid muscle. Together they form a muscular sling, with mylohyoid as the superficial layer of the floor of the mouth. How is the saphenous opening positioned relative to the femoral vein? Inferior, lateral, medial, or superior? Medial. The saphenous opening in the fascia lata is located medial to the femoral vein, allowing the great saphenous vein to join it. What is the relationship between the denticulate ligaments and spinal cord? Anterior, lateral, posterior, or medial? Lateral. The denticulate ligaments are lateral extensions of the pia mater that anchor the spinal cord to the dura mater, providing stability. How are the pulmonary ligaments positioned relative to the lung roots? Posterior, anterior, inferior, or superior? Inferior. The pulmonary ligaments are inferior, sleeve-like extensions of the mediastinal pleura that hang down from the lung roots. What is the position of the hyoglossus muscle relative to the hyoid bone? Superior, superficial, deep, or inferior? Superior. The hyoglossus muscle originates from the body and greater horn of the hyoid bone and ascends superiorly to insert into the side of the tongue. How is the lateral meniscus positioned relative to the medial meniscus? Posterior, medial, anterior, or lateral? Lateral. The lateral meniscus is attached to the lateral tibial plateau, while the medial meniscus is attached to the medial plateau. How are the gastric folds, rugae, positioned relative to the stomach lumen? Internal, circular, longitudinal, or external? Internal. The gastric rugae are folds of mucosa and submucosa on the internal surface of the stomach, allowing for expansion. What is the position of the lacrimal gland relative to the orbit? Inferomedial, anterior, superolateral, or posterior? Superolateral. The lacrimal gland is located in the superolateral aspect of the orbit, within the lacrimal fossa of the frontal bone. How is the detrusor muscle positioned relative to the bladder mucosa? Circular, deep, superficial, or longitudinal? Deep. The detrusor muscle is deep to the mucosal lining and submucosa. What is the relationship between the phrenic nerve and anterior scalene muscle? Medial, anterior, posterior, or lateral? Anterior. The The phrenic nerve descends vertically on the anterior surface of the anterior scalene muscle, deep to the prevertebral fascia. How is the ductus deferens positioned relative to the ureter? Lateral, medial, posterior, or anterior? Lateral. Within the pelvis, the ductus deferens crosses over the ureter laterally to medially as it approaches the prostate. What is the relationship between the foramen ovale and mandibular nerve? Transmits, inferior, superior, or posterior? Transmits. The foramen ovale of the sphenoid bone transmits the mandibular division of the trigeminal nerve from the middle cranial fossa to the infratemporal fossa. How are the arachnoid trabeculae positioned relative to the subarachnoid space? Surrounding, within, separating, or connecting? Within. Find arachnoid trabeculae span and cross the subarachnoid space, connecting the arachnoid mater to the pia mater. What is the position of the ansa cervicalis relative to the carotid sheath? Lateral, posterior, anterior, or medial? Anterior. The ansa cervicalis typically lies anterior to the carotid sheath in the neck. How is the hepatoduodenal ligament positioned relative to the epiploic foramen? Superior, anterior, inferior, or posterior? Anterior. The hepatoduodenal ligament forms the anterior border of the epiploic foramen.